A new study looks into the performance of Canada's mental health care system compared to other developed nations with universal access to health care. And the results, released on World Mental Health Day, are disappointing. The study published by the Fraser Institute today finds that Canada has relatively fewer psychiatric care beds, and it ranks 22nd out of 28 nations. Our country also ranks low with regard to the number of practicing psychiatrists, ranking 16th, and psychologists, ranking 15th. The study points to shortcomings such as a lack of access to appropriate treatments, low rates of post-hospitalization follow-up, relatively poor access to care in rural areas, and greater practitioner-physician preparedness for dealing with mental illnesses. Well, joining us now to discuss Canada's approach to mental health treatment on World Mental Health Day is Ms. Sarah Kennell, National Director of Public Policy at the Canadian Mental Health Association. Ms. Kennell, welcome back to Forum Daily.
Thank you for having me.
So, what is your first impression of these study results? Are you at all surprised?
Sadly, not. This is a real wake up call when it comes to taking a step back and looking at the overall health of our mental health and substance use health system in Canada. Unfortunately, we know all too well that people across Canada aren't getting the care that they need. And this is because of the way our system was set up. It fundamentally excluded mental health and substance use health services from what is considered medically necessary under the Canada Health Act, meaning that many services now fall outside of what you can get through your provincial and territorial health insurance plans. And that means we're seeing really patchwork and piecemeal services across the country.
And would you be able to tell us a little bit more about that, Ms. Kennell? I know we talked a little bit about these shortcomings in our intro, but what is the current state of mental health care in our country right now?
Yeah, we know that about 20% of people in Canada experience a mental illness, and those folks aren't able to get the care that they need in a timely way. Many of those people go to their family doctor as the first point of access into the mental health system in Canada. But unfortunately, as you know, many people don't have access to a family doctor, and family doctors don't always have the breadth of expertise to be able to treat and then care for people with serious and persistent mental illness. And so it's those wraparound supports that we want to see outside of family doctors' offices, outside of hospitals, that is really what this issue is all about, ensuring people have access to counseling and psychotherapy, early psychosis intervention, supported housing for people who need a little bit more help with day-to-day tasks and functions. Also, all the social and emotional learning programs that help us prevent the onset of mental illness and help people recover over the long term. These are the types of supports that we're really looking for and that are chronically underfunded in our system.
Clearly, a lot of gaps here in Canada's mental health care system, ma'am. Can you give us an idea of what's at risk here if we don't take actionable steps to address the mental health of Canadians? I know you mentioned addiction. There's also the issue of high crime rates and its overall impact on the economy. Can you tell us a little bit more about that?
Yeah, fundamentally it's twofold. Really, it's not treating people with dignity and treating the mental health and substance use health crisis for the health crisis that it is, and ensuring that we invest in that crisis from a healthcare perspective and resourcing supports like housing, like food security, like prevention and promotion. The programs that really keep people out of crisis in the first place, which can reduce burden on our acute care system, like hospitals, and also police officers who are really on the front lines of responding across our communities. And as you mentioned, when we do this, we see huge returns on investment through increased productivity and then reduced cost to our health and social service system. So it's a win-win situation in terms of cost-benefit analysis.
All right, Ms. Kennell, just a quick 1 minute left here, but this study compares Canada's mental health care system to that of other nations, about 28 in total. So are there any countries that are doing this right? Can we learn from any particular country when it comes to creating an ideal mental health care system?
Certainly, we often turn to our G7 and OECD countries, particularly those in Europe, where we see legislation that seeks to put mental health and substance use health on par with health physical health more broadly. Even in the United States, they've had parity legislation now for decades. So we're really falling behind our peers when it comes to not only legislating that equality between health and mental health, but also in terms of investment. Canada only invests between 3 and 7% of our healthcare dollars in mental health. And that's far off from the 11, 12, 13% that some OECD and G7 countries commit. So Canada has a long way to go, and we can turn to countries like the UK, Sweden, the Netherlands, and France for guidance on that.
A long way to go. Ms. Kennell, thank you again for your time today.
Thank you for having me.